Okay, good morning, everybody. I'm Dr. Rishikesh, and the topic of my presentation is treatment outcomes in childhood ocular myasthenia. No financial interest in products which perhaps might be shown. Myasthenia gravis in children is less common than in adults. It is almost 35% myasthenia in children usually remains ocular. The present study is aimed at evaluating the outcomes of medical treatment in childhood ocular myasthenia. It was a prospective analysis of childhood ocular myasthenia presenting in 1 year from January to December 2017. The inclusion criteria was children less than 16 years and follow-up of more than 6 months. We did clinical, serological, electrophysiological, and radiological investigations for all these patients. And all patients were started on medical treatment and reviewed for remittance, recurrence, and generalized progression. We had included 8 cases out of between age group 6 to 15 years, male preponderance. Almost all cases had bilateral acquired ptosis, but diplopia was not present in any of the patients. Diurnal variation was present in 5, Coogan's slit twitch in 3. More important is that the positive neostigmine test was present in 7 out of one patient had, the result was not equivocal. So also we tested for thymoma, which was not seen in any of the cases on chest CT. Just a patient whom we performed the ice pack test, which showed significant improvement after 25 seconds of applying the ice pack itself. All cases were managed with oral pyridostigmine and steroids over next 3 months, and they were depending upon their result. The medical treatment was tapered over the next 3 months. The follow-up was monthly during the treatment and 2 monthly after stopping the treatment for 2 years. The findings were noted mainly for improvement of ptosis and improvement in ophthalmoplegia. The results, some patients, some remission after commencement of treatment was seen in all cases. Some amount of remission, not complete, although 4 cases showed complete remission in the first month and rest over the next 2 months. A recurrence on stopping the treatment was seen in only 2 cases at 6 months and 11 months. They were restarted on treatment. One patient has improved, but one is still on treatment. There is no cases of generalized myasthenia in any of the cases. Another patient whom after 3 months of treatment showed total improvement in ptosis and ophthalmoplegia. And also the patient who had incomplete improvement after the initiation of treatment 2 weeks after starting the treatment. So in discussion, it's mainly male preponderance has been seen in this study, unlike the previous studies. Generalized myasthenia in 15% of other, as compared to other studies. Pyridostigmine alone may not be sufficient for remission, and oral steroid has been recommended in literature as well. So 75% remission in the present study is seen compared to 60% as described by other studies. So to conclude, ocular myasthenia in children usually presents with ptosis and ophthalmoplegia of varying degrees. Oral pyridostigmine with steroid helps in remission of these conditions, and early medical treatment helps in remission and avoids chances of recurrence and generalized progression of myasthenia.